Just a comment, there's been at least 4 interventions now on self-monitoring of Coumadin. This is a research question that we need to find out how to help people self-monitor and convince the community that this is doable.
I'm allowed to take insulin. I can self-dose on my insulin,
Right.
but I can't do my warfarin.
There's obviously there's some barriers, but they're not unsolvable.
There's a lady here waiting very patiently for a long time.
I think we're both the same kind of thing. I paid for a self-testing machine. I'm very well aware from Beverly Hunt that 5% of people, it doesn't work. And I think we're both on the 5%. I boxed it up back so somebody is enjoying the benefits of having the machine. So, yeah. I do venous test before I go to work every Tuesday, and if we're doing well, then it gets to fortnightly, and the same as you. Lettuce is one of the answers, and changing your greens, making sure, and you know when it's come through, and you know to adjust it slightly with that rather than fiddling with the medication, and I've 14 years of that. Yeah.
To be honest with you, this is much broader than just APS. This is to do with everybody who's on warfarin. What we probably need is a national policy. So in the United Kingdom, there are some things for which there is a national policy, so everybody, everywhere. In England and Wales, Scotland has a different, but everybody in England and Wales should have access to the same things. I don't think this is one of those things covered by a national policy, and this is why you see variations between different places. So maybe the answer is for there to be a policy.
There's one other thing as well that you were saying about aftercare. I was an emergency nurse practitioner sent home with nothing, same as everybody else, stroke, heart valve replacement, no cognitive ability whatsoever. I was very lucky. I drove over some people when I went to the canteen once and saw the brain injury team. And my husband managed to ask for a referral, so I did get a little bit of help. But people are being sent home with nothing. Yeah, no nurse. My parents were having to drive through to go and have my bloods done and what have you, and diagnosed myself in the end. I was very lucky and got myself to London. But those were just various points. Thanks.
Well, could I just ask, I don't know if people know Estelle Morris, or Baroness Morris. She's a politician, so she knows kind of how things work. So if people want to see changes in policies like this, what should they do? Should they write MP? What should they do?
Well, it's not easy. If you think of it the other way around, there's a limited amount of money and a limited amount of resource in terms of time, effort and energy. And I suppose there's a logic, and this is where it goes wrong, that the government will decide to put the thing that will have an impact on the greatest number of people. So what that does, that compounds the problems which you've spoken about today, about rare conditions. And you can see, and it's actually very difficult to argue logically against that. And so what normally happens is, that's not all they do, but my own experience is that the rarer things, the things that are likely to happen to fewer people or impact on fewer people, are never totally ignored, but they're never given the amount of attention that it needs to make a difference. But what it enables, and this isn't a critical, this is just an observation, I think how we'd all work in similar circumstances. So when you go to the government or the Department of Health of anyone, you can say, yes, we own it, look, it's there. But when you look at it, it's not big enough. It's like a seedling. There's loads of seedlings planted by the department, but there's not enough effort put into the seedling on the rare diseases to enable them to grow and to get strong. My own advice is that, in a way, you've got to go to them with a tiny bit of a solution or one thing. If you go, I mean, when I was a minister, if somebody came to see me with asking 10 things, it was really easy to please them, because you could always do a bit of one of those things at the very least. So you could always write back or say to them, actually, yes, of those 10 things, that one there is something I think we can help. I don't know, it's not deliberate, but the other 9 were all more important than the one that you've said you'd help with. So, and I think our experience in APS support is focus where you want to make the difference. And that does mean, we talk about a partnership. I think you've got to be clear what you're at for. So I know in APS, the thing we focused on for ages was training for GPs and stroke guidelines. That's what I was just thinking about. And so when you mentioned self-testing, just as a charity and with your help and with Professor De Cruz's help, we concentrated on those 2 things. Stroke guidelines, because APS wasn't mentioned in the National Health Service stroke guidelines, and there was no there was no training for GPs. They're not huge, they won't change the world, but they've both achieved. So what you've done to that seedling was you've enabled it to grow a little bit stronger. And one thing the charity's doing now, we're not massively wealthy, but we've got some resource to go on to the next thing. So that's a long way of saying, if you go and say there's all the problems, solve them all, it gets lost in the exhaustion of having to respond to them all. So I think that the movement, if you like, got to be clear what it's asking for. So it just struck me that that request, where are the national lines on self-testing for warfarin? He said, if I was still a politician, I say, come on, surely we can do something about that. Even if we say what's best practice, or there's a phone line, or something like that. That just little thing is entirely doable, even at a time of limited resources. But if you go with the lot, say, Anna, say you go and say, can you solve the problem of we can't get enough patients to volunteer to take warfarin when they're perfect well? The politicians can't solve that. So it's sometimes, I think my suggestion is that, to begin with, it's small steps. Nothing, very few things in politics get changed because of one big step. There's always a lot of steps on the way. So I think we've got to be really clear what the small step is. But it's never going to, it's awful to say it, but it's always going to be competing with things that kill or maim more people. And that's not necessarily fair, but there's a sort of logic about that. I don't know if that's any kind of answer. But, I mean, act individually, writing to MPs. I know when I was an MP, it always mattered. The way I got to find out about things is if I had a constituent that was in that condition. There's odd things I know an awful about because I had one or two constituents who came to see me about it and told me about it. So it's always worth informing your MP and keeping them up to date and be clear with them what they want to achieve, because there's nothing they like better than being able to deliver on that. For instance, they could have, an MP could call an adjournment debate, which is a 1-hour debate, and the title of that the debate could be Developing Guidelines for Self-Testing Kits for Warfarin. That's how we got our campaign going. Any MP might like to do that if you're clear and asking them to do that. It doesn't guarantee the success, but it's at least I feel that's a more manageable, a more realistic way.